Babies grow and develop very, very rapidly. We know that in the first 6 months to a year of life, we are changing clothes and changing, everything around the house because the baby has just taken off. And, it's a very important and fun time, and there are a lot of processes going on together. In the office, it starts from birth. We check different aspects of growth and development. And what I mean by that is the physical aspect and the other aspects, such as cognitive development, fine motor skill, gross motor skills. We're talking about fine motor movements and large muscle group movements. We're talking about social awareness, speech and language, all, from birth all the way on. And so the timeline of the milestones are looked at each office visit. Most of the time, it's through interviewing the parent, but sometimes we can even see it happening right before our eyes. One example will be at 2 months, we expect that the baby should have a social smile or a reciprocal cooing sound, and that's a sign of social awareness, communication. Believe it or not, speech and language, the ability to hear, if the baby startles to sound or turns to a voice if they're a little bit older, are other milestones. And although the baby cannot speak per se, we are assessing these things continuously. And so we go over these milestones with interviewed questions, observation in the office, and we also pay attention to the physical growth of the baby, not just in the weight, but also in the linear growth, the head circumference. We plot the babies on a growth chart to demonstrate to parents their pathway through the growth cycle. We compare the child percentiles within themselves to ensure that there is good proportionality, as well as where they fall in comparison to their peers. So it's important to be quite meticulous about that because there are some missed opportunities if not adhered to carefully. So it is quite a delicate process, but the joy is to see that progress move on. If there is a slight deviation or a concern, we may invite the parents to come in a little bit sooner. It's for a follow-up instead of the routine follow-up that might be months apart. We might bring the patient back in to say, you know what, instead of coming back in 2 months, let's see you in 1 month. Let's remeasure. Let's, provide some advice for other forms of developmental milestones and reassess upon return. Sometimes, if there is a concern, there is a referral to a specialist, whether it's a neurologist or a developmental pediatrician, to assess that particular deficit. Otherwise, for the most part, growth and development are a continuum and very meticulous process and preventative process that we do every single visit. As far as milestones, we know that sometimes, because the visits sometimes can be spaced apart by months, we recommend what's coming up next to the parents, and we set expectations for the following visit. We may also provide some visual aids or some electronic or app handouts so parents can have their own self-guided developmental tracker. So we have wonderful tools to assist parents, not just within the visit, but outside the visit to track. And parents, they are with their babies and their children all the time. And so we say that you are the experts. You are the one who is going to tell us or help us in identifying, concerns that, you may have another child that did something that this child is not, or vice versa. You may have an instinct that is telling you something is not correct, and it's our job to assist you with that. And so we always welcome and encourage parents, if they have a concern, no matter how small, to bring it up to the pediatrician so that we can discuss that and assess that in the office in a timely manner. So again, like I said, it's a continuum. It's an evolving, ever-going process that we enjoy, and growth and development goes on, and it's a wonderful thing. So we do assess that very, very cautiously.